this big. All right, folks, this is evidence-based guidelines, I think they said it was.
Yes.
All right. Evidence-based guidelines is going to be transformed into truck cleanliness. Evidence of that is these trucks are dirty and they need to be cleaned. We're bringing bacteria and crap to our patients. Trucks are not getting cleaned like they're supposed to be. It don't take 10 minutes to wipe down the inside, mop the truck, wipe down the front of it. Plain and simple. We can, if we need demonstrations, Randy and I will put together a YouTube video and you can follow it step by step. We can.
Yes, I would love to see it.
No, these trucks are filthy. Plain and simple. I know the outsides get that way. The last week the truck couldn't be washed because the hose was froze, and now the faucet's froze at Mammoth Spring. We're working on getting that fixed, but there's a faucet down here at Salem. There's car washes all over the place. The trucks can be cleaned. Inside, we have stockpiles of these things. Heavy wipes.
Use gloves.
Wear your gloves or take your chances. Your call. You will not be covered on workman's comp if you're not wearing gloves. Proper PPE. So if you get cancer and you didn't have your gloves on, it's your fault.
Okay, I didn't see that coming, but okay.
Simple. It's not Videx.
Are we still using the spray guns?
We should be using the spray guns at least the beginning and end of every shift.
Okay, so the newer employees probably aren't aware of the psychosis that we had during COVID.
Oh yeah.
And the spray guns, and the stealing of the spray guns, and the re-emerging of the spray guns, and the disappearing of the batteries. So let's talk about that.
And we also mentioned the bed bug epidemic that hit Fulton County Hospital. The spray guns that are in the truck, they're in a black bag with green stripe on them. I think Virex, something like that. Anyways, it's kind of unmistakable what it is. Turn it on.
It's generally behind the captain's chair, correct?
It's on a very fine mist. Spray everything that's in the truck, in the back of it. All of it. Ceiling, walls, radios, cot, bench seat, floor. Partner if he's standing in there.
Accidentally sprayed somebody.
Let that set for about 10 minutes. Then go through, take a rag, towel, wipe down whatever streaks you got. Plain and done. Truck sanitized.
I think actually during COVID, did we spray each other down with it?
Yes.
Yeah, we did. Seriously.
We soaked ourselves down with that stuff.
Yeah.
It was that and Lysol.
That it was.
If you don't have time to wipe your truck down thinking of Lysol, Lysol kills 99.9% of all bacteria and viruses.
Thank you for those evidence-based guidelines.
Spray the truck down. Folks, I'm not asking it to be showroom condition. Chris isn't either. But it does need to be hygienic. Plain and simple. We can't be bringing in stuff from another patient to another patient. You pick up somebody that's in a septic situation and you transport somebody in respiratory distress and you're spreading their germs from the septic one to them, you're not helping them. First order of business, do no harm. Think about it. Plain and simple. Sheets. Change the sheets. The damn green sheets that are in ER do not go on the cot. Our cots are to use flat sheets, the white ones, or apparently you get blue ones up at OMC once in a while. Those green stretchy sheets do not go on the cots.
Well, those will be done away with now that we'll have our own stock room and we're
Yes.
paying. Because Missy come down here and asked how many that we use, and I told her we don't use fitted sheets.
like at all on
Nope.
any of our beds anymore or on the trucks.
Those
So
of you that think it's funny to put them on there because you know it aggravates me, Jeremy, it stops. We can't use those no more. Sheets that we use will be in our supply room, and that's the only sheets we're supposed to be using.
so how can we clean the fronts?
Windex, fantastic. Whatever, just spray the dash down, wipe it down.
But it's fantastic.
The Star Store.
Oh, yeah,
Yeah.
go buy that. Like,
Yeah, I just
oh.
buy it.
Well, I was thinking more along the
Lysol
lines. My Princess truck, I'm starting to get a smell, an odoriferous smell from the cloth seats that we did not used to have.
Yeah, that's probably the
So-
one driving today.
That's what?
It's probably the one driving today.
Well, not necessarily that. I mean,
He gets a big gas.
well, we all do. I mean, let's just be honest. I mean, pointing at you, Harry. Well, I mean, it's going to happen.
Yep.
You know, it's a community seat.
It's got a smell in. This truck's got a smell in it.
Yeah.
You can take one of the throwaway dollar store oil pans
Yeah.
or charcoal in it, just regular Kingsford charcoal, and put it in there, and in about 2 days' time, you won't smell nothing.
Like in the seat,
Put it under the seat or
under
put
the
it,
seat.
Yep.
No,
leave it.
no, charcoal's messy. You don't want to touch where it can spill at all.
that's why you put it in one of the pans.
Huh.
It'll take the smells out.
Well, I guess that's how do you get the Vitalite smell out of the Vitalite trucks?
That one is probably not gonna happen.
Okay.
Folks, please, for 9 cents a day, YouTube, saving EMTs, sanity, by cleaning the truck in the arms of the angel. Please clean your trucks. Please. Please. Please clean your trucks. Thank you.
How do we properly clean the cot?
It should be either sprayed down with the Durex stuff and then wiped down, or sprayed down with Lysol and let dry.
With Lysol.
Lysol is best because you can spray all the straps and everything and let it soak in there really good.
Okay.
Sometimes nursing has a problem with you doing that, but we get out to the bay if they're over at MCED, they request
Okay.
please do not.
So we don't even clean it outside the doors anymore?
Inside the double door. When you first go in,
They got a sign
they
up
got her
in
linen
there.
there.
By
Go
radiology
outside.
or whatever, by the CT scan.
No,
When you
out,
first
back
walk
out
in.
where you park
Yeah.
is where they want you to go. That sign.
Oh.
I don't know whether we fog somebody out with cleaner or something, or what it was.
Well, I mean, I guess it could cause like a respiratory, maybe.
Oh, yeah. Okay, to somebody sensitive to it.
Yeah.
Possibly.
So are we or are we not using bleach?
Only bleach that I know we're allowed to use is whatever's in these cabinets. Regular chlorine bleach.
All right.
Have to use a bleach solution. Cap full.
Are we cleaning straps or are we cleaning straps anymore?
I'm using Lysol on
Every
the
time,
blood soaked.
And I use the cabbie wipes too. When I'm
Okay.
like, good wet. Run them
We're
up and
blessed
down them.
with sinks up at Mammoth, so
Yeah.
we can run hot water peroxide, let them soak in one.
Yeah,
Yeah.
but we gotta
It's-
get, we've been out.
Yeah.
Every time we get blood, we go find some hydrogen peroxide, which needs to be on our list. for Baxter to make sure we keep plenty at the base, because that's the only way we can clean the blood. off
Well,
our
Rachel
clothes.
has it on her shelving back there
Mhm.
in Central.
Yeah, I know, but she's trying to remember everything that we need, and I don't
Mhm.
know if she remembers that we need.
Inside the cab, try to make sure you get your wrappers, eats, spit bottles.
Spit bottles.
Alcohol.
He's not the only one.
Oh no, I'm sure there are others.
There are.
Definitely.
Sorry, I'll try to get mine out.
Please do. Spatulas.
You watched that TikTok, didn't you?
What?
It was a
It's a
spatula.
spatula.
Why did we have this?
I don't know. She said something about a motorcycle.
Oh, that's funny. No, I forgot why we had a spatula over there. don't
I
remember.
think you took it from the base of your house or something and left
Yeah,
it in the
I
trunk.
think I was baking something and it fell off my tray. It was, yeah. Okay, I'll be right back.
All right. If you find it in. Well, I have nothing further on cleaning your trucks other than do it. All supposed to do this. It's part of our job. We get to do it. Have a day off and volunteer.
So we've reiterated before in meetings and we've sent out texts before. Of course, we've got new employees. We've seen a complete rotation since I've been here. I think there's probably a core 7, 8 of us. It's been here since I've been here. What degree? What's the cutoff for cleaning the outside of the trucks?
40 degrees.
40
Anything
degrees,
below 40.
but you still have to clean
Clean
the inside.
And
Inside.
it wipe off the headlights so people
Even
can
if it's
see
40
you. when
below,
you can go
wipe
up there.
down the inside.
He wiped off all the
Now,
lights so
folks,
we could see, even though we couldn't wash it.
Mhm.
We've always handled that here. We got new, bigger bosses,
Yeah.
so be mindful. Standards may be a little bit higher up there.
Well, and two,
Professionalism.
that's exactly what I was fixing to say, is that we still even though we're being absorbed, we're still our separate entity.
Yes.
And so we want to make sure that we're proud of that and that we're showing that we're proud of that.
Health department sent out an email to every EMS provider in the state. They will start doing spot inspections, and they can pull you over at any given time. If they get in the back and that truck's dirty, guess what? Your service gets fined. Your license could get
Dust.
dust. Trucks don't have good seals on them. No fault of anybody's. They're just getting older. You go down Many Islands Road, you've got a mud farm.
What should we do with smelly patients? We have several. We
I
have
say no transport. Not serious, not serious. You have your vent fan in the back. You can't open that side window on the door to get an airflow going through there, so it's not.
I think we just have one truck left that does that.
Well, we may.
Princess truck don't.
We might see about putting some fans. Take out window
Mm-hmm.
and blow air from back.
In your face.
Stagnant.
Yeah. Yeah. Our patient on Fondwood, she usually she's rather odorous when we get her. So when we get to the hospital, usually I keep the doors open until we get back in it.
That's another thing. We're at these hospitals and you've got cover. Leave them doors open. Let that truck air out a little bit. You're out in the middle of nowhere and the truck's open, there's leaves and rabbits and squirrels and crap falling around. Don't
I'd
do
be
that.
concerned in the city.
Like in Springfield or Little Rock.
Or anything like
Yeah.
that.
Oh, yeah, no, we'll have.
Nothing left.
Have renters with squatters.
All right, anybody got any questions? David, I think you're the only one on TV land. This will conclude evidence-based guidelines.
He said no question.
All right, thank you, David.